Good evening, ladies and gentlemen. On behalf of the Board of Directors of the Gulf Society for Maintenance and Reliability and our Events Management Committee Chair, Mr. Abdul Rahman Al-Dawsari, we welcome you to this exciting technical platform webinar titled Diabetes and Fasting During Ramadan. First, I would like to say a few words about GSMR. GSMR is the leading nonprofit organization for maintenance, reliability, and asset management professionals. We welcome all industry leaders into our society where they can enhance and upgrade their skills through training and certifications, networking, and publications. We are proud to announce that we are the first society in the Gulf to have the first of its kind homegrown certification called MARC, Maintenance and Asset Reliability Certification. In addition, we are the affiliate for the World Partners in Asset Management, WPIAM, and you can take the Certified Asset Management Assessor exam through GSMR. Our moderator for this evening is Engineer Ali Al-Jamaan. Ali graduated from King Fahad University of Petroleum and Minerals and joined Saudi Aramco in the Maintenance Engineering Department to pursue his passion for maintenance. He has further achieved the CMRP and PMP certificate and finished his master's degree in Reliability Engineering and Asset Management from the University of Manchester. Please welcome our moderator for this evening, Engineer Ali Al-Jamaan. Engineer?
Thank you, Annie, for the nice introduction. السلام عليكم جميعا ومبارك عليكم الشهر. تقبل الله أعمالنا وأعمالكم. May God accept our prayers and grant us His mercy, inshallah, during this holy month. Ladies and gentlemen, welcome to GSMR's technical platform webinar on diabetes and fasting during Ramadan. This webinar is part of our social responsibility to raise the awareness of health issues and challenges during the month of Ramadan. This awareness is crucial to ensure a safe Ramadan experience for all. As you know, fasting, the 9th month of the Islamic calendar, is one of the 5 pillars in Islam and is mandatory for all healthy adult and adolescent Muslims. However, there are many exemptions from fasting, including people with a chronic illness such as diabetes. Tonight, we welcome Dr. Maher Shaheen, an endocrinologist and diabetologist. He is a member of the Syrian Board of Endocrinology and Metabolic Diseases with more than 15 years of experience. Currently, he is a diabetic specialist at Bahrain Hospital in Department of Internal Medicine. Dr. Maher is going to drive us through diagnosis and testing of diabetes, benefits and possible complications of fasting, 7 points guide for glucose monitoring, and some nutritional facts and medication. And before passing it over to Dr. Maher, just a quick note to our audience. Please feel free to ask your questions to our presenter by typing them in the chat box as we speak. And our guest speaker will be answering them during the question and answer session. Thank you all and wish you all enjoyable session. Dr. Maher, the mic is yours.
Thank you, Mr. Ali, for your nice introduction. السلام عليكم ورحمة الله وبركاته. إن شاء الله صياما مقبولا تقبل الله طاعاتكم وصيامكم. Good evening, everybody. It's nice to meet you all. Today, I would like to talk about diabetes and fasting. So, can share with us. So first, I will start. First, I will start with a brief overview of diabetes. Diabetes is a complex disease characterized by high level of blood sugar. Chronic high blood sugar is the most common cause of blindness, heart disease, and kidney failure. Diabetes is one of the most common diseases in the world. Over recent decades, the prevalence of diabetes has been increasing throughout the world. And this trend is set to continue. In 2019, it was estimated that there were approximately 463 million people with diabetes in the world, with 1 in 2 adults are undiagnosed. And this total number is predicted to rise to 700 million by 2045, around 10.9% of the population in the world. In our area, Middle East and North Africa currently has the highest diabetes prevalence, almost 12%. Some countries such as Bahrain, the prevalence of diabetes reached 17 to 18% of the population. In general, diabetes is classified mainly to two types. Type 1 diabetes, which is characterized by absolute insulin deficiency due to destruction in the beta cell of the pancreas. So patient requires insulin therapy for lifelong. Type 2 diabetes is characterized by insulin resistance, and around 90% of diabetic patients have type 2 diabetes. This type of diabetes can be treated or managed by oral anti-diabetic agents. Now, how we can diagnose diabetes? It is very simple very easy to diagnose diabetes. Just check blood sugar and give us the idea about the glucose situation in the body. So we can say that you have diabetes if the fasting blood sugar more than 125. Fasting is defined as no caloric intake at least for 8 hours, or random blood sugar more than 200 milligram per deciliter, or HbA1c. This test, HbA1c, measures the average of blood sugar during the last 2 to 3 months. If HbA1c more than 6.5, so can diagnose diabetes. Or during oral glucose tolerance test, usually we give 75 grams of glucose orally, and after 2 hours we check blood sugar. If it's more than 200, it can diagnose also diabetes. So if patient doesn't have any symptoms suggest diabetes, we have to repeat the test after 2 to 3 weeks. If patient have symptoms suggest diabetes, so one test of this can diagnose diabetes. As we know, the first stage or first year of diabetes is asymptomatic. I mean, patient doesn't have any symptoms. So for that reason, it's very important to detect elevated blood sugar during this stage, even without any symptoms. And it's very important to start a treatment for complication prevention. So who should be tested for diabetes, even without any symptoms? Actually, all patients or all people with age more than 45 years should be tested for diabetes every 1 to 2 years. And regardless of the age, any obese patient or any overweight adult with one or more risk factors should be tested for diabetes every year to 2 years. Risk factors of diabetes include first degree related with diabetes, history of cardiovascular disease, high blood pressure, or HDL or good cholesterol less than 35, or triglyceride more than 250, or women with polycystic ovarian syndrome, or patients with sedentary lifestyle without activity, or there is some clinical signs suggest insulin resistance, such as central obesity only in the abdomen, or acanthosis nigricans, which means presence of a black area on the neck or axilla. For these people, even if they don't have any symptom, they should be tested for sugar every 1 to 2 years. Now back to our presentation this night, diabetes and fasting during Ramadan. According to Quran, fasting during Ramadan is one of the 5 pillars in Islam, and it's mandatory for all healthy adult Muslims. Ramadan fasting involves abstinence from food, drinking, oral medicine, smoking, and sexual activity from sunrise or sahur to sunset or iftar. There are many exemptions from fasting, including people with chronic illness. But a large population of Muslims with diabetes insists on observing fasting despite expansion and awareness of fasting risks. Absolute restriction of fluid intake between dawn and sunset is integral aspect of Ramadan. This can have potentially important consequences, particularly in individuals with poorly controlled diabetes. In 2019, the number of Muslims approached 1.9 billion, which is about 24% of world population. And in our area, Middle East and North Africa, around 93% of people are Muslims. That means there are around 148 million Muslims with diabetes across the world. The recent study found that 42% of patients with type 1 diabetes and 78% of those with type 2 diabetes fasted for at least 15 days during Ramadan. That suggests there are over 116 million Muslims with diabetes across the world may fast during Ramadan, but only 37% of patients with type 2 diabetes were self-monitoring their blood glucose level. So what's the physical and mental benefit of fasting during Ramadan? There are many studies showing that fasting during Ramadan can improve the weight, cause weight reduction, and improve the body mass index. Also, for patients who have non-alcoholic fatty liver disease or patients who have fatty liver disease, fasting during Ramadan, it's associated with a greater reduction in the inflammatory markers or disease markers, and greatest reduction in the liver enzyme, fasting blood sugar, and insulin resistance. Also, fasting during Ramadan can be associated with significant reduction in LDL, which is bad cholesterol. And this could lead to more prevention against heart disease and stroke. Fasting during Ramadan can also help people learn how to conduct self-control, and this may help with people who previously had bad eating habits. The true observance of fasting during Ramadan provides an opportunity for all people to break pattern of smoking and general any addictive patterns, and can significantly improve well-being. During Ramadan, individuals build on their faith, read and listen to instruction of the Quran, and participate in prayers. And this will all been associated with declining rate of depression and anxiety and improvement in the memory and overall mental well-being. On the other hand, it's the adverse effect of fasting during Ramadan. And many studies show that fasting during Ramadan can be associated with a sleep time reduction around 1 hour. Sleep deprivation has been associated with insulin resistance, with increasing in the blood sugar also, and increasing obesity. Other adverse effects include some people, they feel temporary more anxiety and irritability, especially before iftar. Also, in Ramadan, we noticed the risks related to chronic disease such as diabetes, hypertension. Also, that weight reduction, which was mentioned in previous slide, usually it is temporarily. So we will talk about possible complications or risks of fasting during Ramadan in diabetic patients. Fasting among patients with diabetes who have inadequately managed blood glucose levels is associated with multiple risks, include low blood glucose or hypoglycemia, especially during the late period of fasting before iftar, or increasing high blood sugar, especially after a main meal or after iftar. Or it can happen even with fasting hours, because most of patients, they reduce their insulin dose or they reduce the dose of their medication during Ramadan. In general, hypoglycemia is defined as full of blood sugar less than the normal range, less than 70 milligram per deciliter. Hypoglycemia can present with many symptoms such as headaches, palpitations, sweating. If there's no proper treatment, patients will develop confusion, then coma. Hyperglycemia or high blood sugar, defined as elevated blood sugar more than 200. Usually patients develop feeling thirsty, develop frequent urination, abdomen pain, blurred vision. If there is no proper treatment, patient will develop something which is called diabetic ketoacidosis, especially in type 1 diabetes. So what's the diabetic ketoacidosis? When the body cell don't get enough glucose, it starts to burn fat for energy. When the body burns fat instead of glucose, it causes waste products called ketones. Ketones can make the blood acidic, and this can be dangerous and cause coma. And if there is no proper treatment, patient can it will be a life-threatening case. So patients with type 1 diabetes who chose to fast during Ramadan are at high risk to developing the ketoacidosis, especially if they have been experiencing high blood sugar before Ramadan. Also, fasting during Ramadan can cause dehydration due to the lack of the fluid intake, as well as the hot and humid weather in the country. Dehydration can then result in a higher blood viscosity or thickness, which increase a chance of thrombosis or blood clots. Some studies showed that stroke prevalence or stroke incidence increased during Ramadan month. So for diabetic who choose to fast during Ramadan, it's important to drink plenty of water during non-fasting hours. Staying hydrated can help prevent dehydration and associated complications. Also, some patients or diabetic patients in Ramadan, they gain significant weight due to increased caloric intake in iftar and sahur and reduced physical activity. Also, sudden kidney failure in patients that are prone to dehydration, such as elderly age or this with reduced kidney function. So we can classify diabetic patient in to three groups for fasting. First group, it is a very high risk group. It includes patient with uncontrolled or poorly controlled type 1 diabetes or poorly controlled type 2 diabetes, or patient who receive multiple injection of insulin daily, or pregnant patient who receive insulin, or patient with diabetes and kidney failure. These people, they must not fast. Second group include patient with well-controlled type 1 diabetes, patient with well-controlled type 2 diabetes or mild kidney failure, patient pregnant with diabetes who receive oral medication, patient with diabetes with stable complication. This group should not fast. If they decide to fast, they have to monitor their blood sugar at least 6 to 7 times daily. Third group include low-risk patients, which include patients with well-controlled type 2 diabetes. They don't receive insulin or multiple dose of insulin. They don't have any complication. They are aware and they are stable. They don't have history of high sugar or low blood sugar. They can monitor their blood sugar. So this type of patient, they can fast safely during Ramadan. So if diabetic patients decide to fast during Ramadan, it's very important to measure blood glucose level. In general, patients should measure blood sugar 2 hours after iftar to detect high blood sugar, and at midnight and before sahur. Also, he should monitor or check blood sugar in the morning between 8 to 9 o'clock a.m. and midday between 12 to 1 o'clock and afternoon 3 to 4 o'clock and directly before iftar. If patient have a stable blood sugar and he's taking oral medication for diabetes, he can reduce the number of the readings. So he can check blood sugar between 10 to 11 a.m., between 3 to 4 p.m., and 3 hours after iftar. This monitoring of blood sugar is very important to reduce all complication and make the fasting more safe. So when patient should break the fast. Actually, all individuals should break the fast if their blood glucose less than 70, or if their blood glucose more than 300, or if they develop symptoms suggest low blood sugar or hypoglycemia, such as excessive sweating, palpitation, hunger, confusion, headache, blurred vision, or if patient develop symptoms suggest hyperglycemia or high blood sugar, such as extreme thirst, hunger, frequent urination, fatigue, abdomen pain, nausea, vomiting, shortness of breath also. So patient should break the fast and eat 3 teaspoons of sugar or half cup of juice and start oral hydration. Now, what about the lifestyle during Ramadan? For exercise, normal levels of physical activity can be maintained for most diabetic who choose to fast. Exercise during fasting hours, especially before iftar, is not recommended, as it may lead to hypoglycemia or low blood sugar. It's advisable to rest before iftar. However, people with diabetes are advised to avoid sleeping during this period in order to remain alert to signs of hypoglycemia, which is more likely to occur during the later hours of the fasting day. The best time for exercise is during the evening, 2 hours after iftar. In general, going to Taraweeh prayer can also be considered as part of your daily exercise regimen during Ramadan. What about nutrition during Ramadan? Usually we advise people, or especially diabetic people, to avoid adding butter and ghee to food. We advise them to drink at least 8 to 10 cups of water between iftar to sahur, and avoid eating more than 3 dates per day. Each date provides 20 calories and contains 1 teaspoon of sugar. So it's best to start your iftar meal with the dates to get your blood sugar back to normal level. Also, patient should try to eat and drink low-fat soup, like vegetable, lentil soup. If the patient plans to have a cream soup, should replace the cream with skimmed milk. Also, cheese or walnut qataif can range from 200 to 400 calories in a piece. So it's very important to avoid these types of food. However, if patient choose to eat them once a while, so it's better to use low-fat filling and reduce the density of sugar in the syrup. So in general, when you talk the nutrition, carbohydrate should be around 40 to 45% of total caloric intake per day. We recommend to use low glycemic index carbohydrate, such as whole grain, uh, fruit, green salad, and it's better to avoid white rice and white bread, cakes, sweets, sugar. Protein should not be less than 1.2 gram per kilogram, around 80 to 100 milligram, 100 gram per day, or 20 to 30% of total caloric intake. We prefer to take protein from sources such as fish, skin legs, chicken, milk, and dairy products, nuts, seeds, and it's better to avoid red meat because there is a relationship between red meat, lamb, and beef and cardiovascular disease. We talk about fat. Fat should be around 30 to 35% of total caloric intake. It's not related to amount, it's related to type of fat. So it's better to avoid ghee or butter or fat from animal source like red meat. It's better to use vegetable oil, olive oil. Now, we'll talk briefly about medication during Ramadan. I mean, anti-diabetic medication during Ramadan. Actually, we start with metformin. Metformin, this is the commonest medication in diabetes. Metformin is considered safe for fasting, and no dose modification is required. For patient who is taking one tablet every day, it's better to take it at iftar time. If patient take twice a day, it's better to take it at iftar and sahur. 3 times, he will take 2 doses at iftar and 1 dose at sahur. If he's taking metformin XR or prolonged release, he can take it in iftar. Sulfonylurea groups, including diamicron and amaryl. This group of medication is well known to cause prolonged hypoglycemia or low blood sugar. So it's better to avoid it during Ramadan. However, if patient is taking it for long time, he can continue with this type of medication, but he has to monitor blood sugar many times per day. So a patient is taking this type of medication once daily, this medication should be taken at iftar. If his blood sugar is controlled or well controlled before Ramadan, it's better to reduce the dose around 50%. If he's taking this type of medication twice a day, he will take full dose at iftar and half dose at sahur. Other types of medication like Actos, this type of medication is safe for fasting. There's no issue with this medication, no complication. Patient can take it at iftar or sahur. New generation of antidiabetic medications such as Victoza, Ozempic, Trulicity. This type of medication is very good for diabetes and it's helped for weight reduction during fasting. There's no dose modification during Ramadan and it is safe. There's no complication with this type of medication. We talk about insulin. For patient who is receiving multiple dose of insulin per day, it's better to avoid fasting. If he wants to fast, it's better to check blood sugar 7 times daily. However, if patient is taking basal insulin, such as Lantus, Tresiba, or MPH, this dose should be taken at iftar. If his blood sugar well controlled, it should be reduced around 15 to 30%. For short-acting insulin, such as Novorapid, which given many times per day before meals, this type of insulin should be reduced by dose around 25 to 50%. However, patient who's taking insulin, it's better to avoid fasting. This type of medication, Trajenta, Galbuzamate, Januvia, Janumet, they are considered as safe for fasting. There's no dose modification during Ramadan. Patient can take it at iftar or sahur without any problem or complications. Other new generation of antidiabetic agents, Forxiga and Jardiance, this type of medication increase glucose expression in the urine, so it can cause dehydration. So it's better to avoid it during Ramadan. However, if patients taking it for a long time, he can continue with this type of medication, but he needs extra hydration to avoid dehydration. And it's better to avoid fasting in elderly age who's taking this medication, or patient who have kidney issue, or patient who's taking diuretics during Ramadan. So, in conclusion, most of patients with diabetes, type 2 diabetes, they can fast Ramadan safely without any complication. Small group of patients, including patients with complication, elderly age, multiple medication, receiving insulin multiple times per day, it's better to avoid fasting. If they insist to fast, it's better to monitor their blood sugar around 6 to 7 times per day, and they break fast if they have symptoms of high blood sugar or low blood sugar. Thank you very much for your listening. Any question, I'm ready to answer.
Thank you, Dr. Maher, for the comprehensive presentation. And I think it's time to fulfill our audience's drive in the question and answer session. Please, ladies and gentlemen, if you have any question or a clarification, just put it in the chat box to be answered by our guest speaker. As you all know, most of us are having relatives with diabetic disease. And I would like to start first by myself, allow me, Dr. Maher. And what I captured my attention is that exercise, it's better to be avoided before iftar. Although the fact that within the group of people, all discussion is like competing with each other who's doing the exercise at that specific period of time. What is really happening to our body at that specific period, Dr. Maher?
When we talk about now, we are talking about specific people with diabetes. So this period, 2 3 hours before iftar, the risk of hypoglycemia or low blood sugar is major. So patients better to avoid exercise, to avoid sleeping also in this period, to be aware for any symptoms of low blood sugar, which could be very dangerous. So this is the reason, just to avoid low blood sugar in this critical period.
يعطيك العافية دكتور ماهر. Another question is that why should diabetic patients especially not sleep before iftar?
Yeah, it is the same idea, because before iftar, there's risk of low blood sugar because already patient fasts at least 12 to 14 hours and he took medication which can cause low blood sugar. And after all this period of fasting, the risk of low blood sugar is very high. So patient during sleeping can develop blood sugar and he doesn't know that, which can be very harmful. So it's better to avoid sleeping in this period, to be aware for any symptoms of low blood sugar like palpitation, sweating, blurred vision, headache. So directly patient should be breaking the fast. If he is sleeping and there's nobody around him, he will develop low blood sugar and he will maybe go with coma. I cannot hear you. You mute your.
Thank you, Dr. Maher.
Yes.
Can you hear me now? Okay, great, great. I think we have one question. Maybe you have just brushed on it during your presentation. It's from Ibrahim. It's about what are the symptoms that the patient should stop the fasting? When the patient, let's say, she should stop fasting.
Yeah, actually, if there's symptoms of, when we talk about the diabetic patient, the symptoms
Yes.
of high blood sugar or low blood sugar. Symptoms of high blood sugar include excessive thirst, frequent urination, headache, feeling hunger, also fatigue, constipation, abdomen pain, nausea or vomiting. Also, if there's no proper treatment, patient will develop palpitation, shortness of breath, then confusion. These are symptoms of high blood sugar. Symptoms of low blood sugar, including excessive sweating, palpitation also, tremor, shivering, including headache, blurred vision. Patient feels suddenly he's down like that. But first step, he has to check his blood sugar to confirm this is symptoms related to low or high blood sugar.
طيب يعطيك العافية دكتور إبراهيم. I think someone is raising his hand. We have another question also as well from Ibrahim. For kids, how the parents can assess their conditions if they are diabetics?
Actually, most of kids have type 1 diabetes, and they are receiving insulin. And usually they are receiving around 3 to 4 doses of insulin daily. For this type of diabetes, fasting is not recommended at all. If kids, they want to fast, there are many devices to monitor blood sugar, which called continuous glucose monitoring. This device can attach to the skin in the hand or the abdomen, and it check by the glucose by itself every 15 minutes and give alarm if there is low blood sugar or high blood sugar. This is very good for this type of patient who want to fast. But in general, we don't advise this patient for fasting at all.
Thank you, Dr. Maher. We have here a question from Abdul Rahman. What do you recommend to break your fast with in order to maintain DM glucose level?
To maintain?
DM glucose level.
Usually, no problem if even for diabetic patients, no problem if they break their fast in high blood sugar, high sugar food like date or drinks, because their blood sugar it's in lower side before iftar directly. So they need some sugar which can increase blood sugar directly quickly. So now we recommend to break with date at least, but at يعني maximum 3 days, more not more than 3 days.
سبحان الله نفس سنة النبي اللهم صل على محمد. طيب just a reminder for our audience, if you have any questions, please type it in. We have here Mr. What is the difference between fasting in Ramadan and intermittent fasting? Why is it people lose weight in intermittent fasting? And you mentioned that one possible complications in fasting during Ramadan is significant weight gains.
Significant.
Or do you need me to repeat it?
The intermittent fasting, same fasting during Ramadan. But during Ramadan, there's something related to the religion, related to the Islam. Yani. Intermittent fasting just for weight loss. But even intermittent fasting can be associated with weight gain. But in general, because there's social habit. During Ramadan, there's no activities, eat more sweets, many dishes in iftar. So fasting during Ramadan, it is not for weight loss. Fasting during Ramadan, because Islam is ordered that. It's not for weight loss, but intermittent fasting is for weight loss. So patient will take care about his food also. It is diet and fasting. But during Ramadan, usually there's no diet, only fasting.
It is much more related to their habits as well.
Yes.
Or intermittent fasting. Here we have another question from Ibrahim. Do you recommend to change the medicine during Ramadan, or you just mentioned change the dose?
Some medication which can cause low blood sugar, such as Amaryl, diamicron, it's better to change it, especially if patients have events of low blood sugar before Ramadan. But in general, if patient is comfortable with his medication without any problem before 3 months, at least before Ramadan, he can continue with same medication. But if his blood sugar will controlled, and he will fast around 12 to 16 hours, it's better to reduce the dose around 25 to 50%.
We have here a question from Tayma Nasser. What is the difference in the risks of fasting between type 1 and type 2 diabetes?
Actually, both types, as fasting with type 1 and type 2 diabetes, can be associated with dehydration, with high blood sugar, with low blood sugar. But fasting with type 1 diabetes is more dangerous because it's associated with something we mentioned about it. It's diabetic ketoacidosis, because there's absolute deficiency of insulin in the body. And most of these people with type 1 diabetes who decide to fast, they reduce their insulin dose at sahur because they are afraid about low blood sugar. And that can cause high blood sugar in midday or end of the fasting day, which can be very dangerous because it causes dehydration. Then dehydration causes increased blood sugar, and this is a cycle. Develop acidosis, ketone, then acidosis, then symptoms, then coma. But usually, in general, this type of patient, they can recognize these symptoms directly. They can recognize there is ketosis, there is acidosis, and they break their fast directly. But in general, with type 1 diabetes, it's more dangerous because the risk of low blood sugar is high blood sugar, dehydration is more.
We have here another question from Ibrahim. What is the best time to do sport during Ramadan?
After iftar. After iftar, this is the best time. Especially in the hot and humid climate. So it's after iftar the best, around 2 to 3 hours.
Okay. Another question from Muhammad Ibrahim. For people who face almost daily headaches and are used to taking medicine in the morning, how do they avoid headache symptoms while fasting? I don't think this is related to our subject, but if you have...
They are taking morning medicine for headache?
Yes, it's much more related to headache. I think it's not related to our subject, yeah, Muhammad. Or is there anything, can you please clarify more? Is there anything related to diabetic? We'll be waiting for your clarification. We'll go for Abdul Rahman. Do you recommend that we have iftar in 2 periods? Like after Adhan, we'll have light meal, then we'll have other meal after Maghrib. Yani they will start breakfasting with dates, and then after a while, they will come and have the big meal.
There's no big difference actually if he take it in 2 times or one sits. There's no big difference.
So, what do you
But usually
recommend?
they break their fast, then they go for Maghrib, Salat Maghrib, then they eat regular iftar.
And as well on sahur, is there any recommended type of meals on sahur for the diabetic patient?
Usually usually we prefer to avoid the sweets, the carbohydrate-rich food during sahur. It's better to eat more protein during sahur, whole wheat bread during sahur, lentil or growing during sahur, because this can release blood sugar in the blood slowly. But if we take something sweet or high carbs food during sahur, it causes big of high blood sugar. After short term, it causes low blood sugar. So it's better to eat more protein during sahur.
Shall the diabetic patient also to consider, let's say, partial meals in between the period from iftar to sahur to maintain his blood sugar, or you can explain
Actually,
more?
actually, this is all practice related to the medicine what patient is taking. Some types of medicine or sometimes also of insulin can cause low blood sugar if patient skip his meal or he fast for more than 8 or to 10 hours. For this reason, if patient take this type of medication like diamicron, like Amaryl or NBH insulin, it's better to take a small meal between iftar and sahur. Other types of medication or new medicine, like I mentioned about Janamate, Forxigas, Jardians, this type of medication doesn't cause low blood sugar, and it decreases the high blood sugar, but normal blood sugar doesn't go more down. So in this stage, if patient doesn't feel hungry, it's no need to eat if he's taking this type of new medication.
We have a question from Dr. Wissam, and I think this will be our last question for our audience. Inshallah, we have a lot of questions. My uncle feels dizzy after drinking or eating anything except water after Maghrib. He needs 2 hours to feel comfortable and normal. These are new symptoms. He did all normal blood tests and all are normal. Any recommendation, suggestion? Dr. Wissam, if you can clarify, is he having diabetic?
He has diabetes or is healthy?
I think he's having diabetes. No, he's not having diabetes.
He's not having diabetes, but feeling dizzy after eating directly.
I think it's
He's
better to
obese,
go.
100% he's obese. And he has insulin resistance.
I think also as well, you need to go to specialists also as well to discuss this with him. He needs further diagnosis as well, yeah, Mr. Maher, Dr. Maher, isn't it? طيب, I think
some
we
people,
reached to...
some people, obese people, they have something which is called reaction hypoglycemia or reaction low blood sugar. They are develop low blood sugar after eating directly or after even many hours after eating. This is, it's not very serious condition. You need to eat multiple small meals. Just to eat not one big meal and finish. Eat multiple small meals. This is the treatment for this case, and this is benign case. It's not dangerous. And it could be this is sign of pre-diabetes. I mean, this patient will be at high risk to develop diabetes in future.
يعطيك العافية دكتور ماهر. I think we reached to the end of question and answer session. It's been my pleasure being with all of you today. Thank you. I would like to appreciate the efforts and time to our guest speaker, Dr. Maher Al-Shaheen, endocrinologist and diabetologist specialist of Bahrain Specialist Hospital. You really raised our awareness tonight in safe fasting during Ramadan for diabetic patients, risk that to be aware of during fasting, treatment required if low blood pressure, blood sugar experienced, and precautions to be considered during fasting. I hope I served the excellent presentation and the active discussion between our precious audience and Dr. Maher. Just I would like to repeat the same verse from Surah Al-Baqarah that was shared also by our guest speaker. أعوذ بالله من الشيطان الرجيم. شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصمه ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون. صدق الله العظيم. Before I conclude, I would like to acknowledge our board member of GSMR, Mr. Ibrahim Al-Hadi. In the end, I wish you all the prosperity, healthy life, and happy Ramadan. And Annie, I will pass it over to you.
Thank you very much, Ali and Dr. Maher. What a wonderful seminar. We learned a lot about diabetes and fasting during Ramadan. And I would like to thank Dr. Maher and Khalifa and the PR team of the Bahrain Specialist Hospital for a very informative session. And we worked with them in order to bring this very informative webinar. And this webinar will be available on YouTube and on our social media platforms. So please watch out for that. What an exciting evening. We hope that you have learned a lot from this webinar. And if you are not yet a member of GSMR, please don't hesitate to join us and invest in your professional growth. Follow us on social media at GSMR Society. And now I would like to, I will enable the camera for everybody so that we can take a photo. And we will, of course, possibly post it on our social medias. So just give me a second and I will enable your cameras. So get ready to turn it on. Okay, everybody, you can turn on your cameras. Perhaps Mr. Dr. Maher, you can turn off the slide so that we can see the people.
Yes. Now it's okay.
Yes. Everybody, please turn on your cameras and we will have one photo with everybody. Okay, if we are all ready. 1, 2, and 3. Okay, we'll take another photo. All right. 1, 2, and 3.
Wait, one more.
Okay, yes, please, Khalifa.
Yes.
Okay, awesome. 1, 2, and 3. And with that, we wish you all a good night. Have a safe Ramadan and an enjoyable experience. And watch out for this webinar on our YouTube channel at GSMR Society. Goodbye, everybody. Good evening.
Good evening. Goodbye.
Good
Thank
evening,
you.
Ali,
Thanks,
Dr.
Maher.
Maher, Khalifa. Thank you,
Thank
everybody.
you.
Bye-bye.
Thank you. Masalam.